Hi, it's Dr. Burnett again from Westfield, New Jersey. I'm a board-certified plastic surgeon here to talk to you today about the tummy tuck or abdominoplasty. The abdominoplasty is a procedure that helps to manage excessive fat of the abdomen. Basically addresses the skin, the fat, and the muscle in that particular region. I find that when we do abdominoplasties on patients or tummy tucks on patients, many times we also have to do liposuction at the same time or concurrently. We do that around the flanks so that a patient doesn't look flat in the front and then bulging on the sides. Then the bodies don't look very well balanced or congruent. So we do that as a part of our body contouring to achieve the best result for our patients. The full abdominoplasty is perhaps the most common abdominoplasty, and that's where the skin is elevated just to below the breastbone and the belly button is repositioned after removal of fat and the excessive skin. The patients who present for abdominoplasty usually have some skin that overhangs or just a lot of fullness around the abdomen. Depending on the position of a patient's fat deposition, we can decide whether the patient needs a full abdominoplasty or something called a mini abdominoplasty. The mini abdominoplasty is usually for a patient who has a nice upper abdomen that's relatively flat but has a bulge that begins just below the belly button. That patient can usually have what's called a mini abdominoplasty, where an incision is made just below the groin crease and the muscles are tightened from the belly button down to the area called the area of the pubis, or lower in the pelvis. Now, when a person says mini abdominoplasty, many times we're confused and think that means an abdominoplasty through a small incision. That's not the case. A mini abdominoplasty just means that we haven't dissected all the way up to the central portion of the lower chest and tighten the muscles from above all the way down to that pelvic region. So when we say mini abdominoplasty, one should specify that incision can be long as well, but it addresses just a lower area of abdominal fullness. The concern that many patients have is that, is my scar going to be long, doctor, or is it going to be thin? Unfortunately, with abdominoplasties, one should really say that, or inform the patient that the longer the incision, usually the better the result, because many times the patients who present with these complaints can be somewhat overweight and have folds of skin and fat that need to be addressed by excision of the fat as opposed to liposuction of the fat. And that means that the patient will need a longer incision. I particularly try to keep my incisions long and low, or at least low, so that they can be hidden in the bikini line or the panty line. This allows the patient to get back into their social interactions without it being particularly noticed. I often talk about getting a person beach ready or beach body ready, and that principle is based on just having the contour that a patient who would never have worn a bikini to have the idea that, you know what, if I wanted to, I could wear a bikini. And I think that that's one of the important things with abdominal contour. If you make it a point as the plastic surgeon to inform the patient of the areas that they need to enhance so they can get the result that can really be pleasing aesthetically, I think you've done your job.